Hello, namaste, good afternoon to all the Facebook Live listeners today. Hello, namaste, good afternoon to all the listeners of today's Facebook Live. I'm Dr. D.R. Kulkarni, a liver and pancreatic surgeon associated with L Raheja Hospital, a Fortis associate. And today going to share few facts about the dangerous liver and pancreatic and gallbladder cancer with all the listeners. Why I have chosen the liver, pancreatic and gallbladder cancer, the reason behind that is all these cancers are actually on a rise, and out of these, liver and pancreatic cancer are amongst the top 10 cancer related deaths in the world, and that includes India as well. Even though currently the records may show that the proportion of liver and pancreatic cancer is less in India, it is still formidable because of the population. Plus, the gallbladder cancer is very, very common in India, and it is very much associated with the gallbladder stones. So, first coming to the liver cancer. Liver cancer is commonly associated with the various viral hepatitis associated diseases like viral hepatitis B or viral hepatitis C, or it is associated with alcohol. But most importantly, in today's era, it is associated with obesity, diabetes, metabolic syndrome, as what we call it, or non alcoholic hepatitis, or fatty liver. So, in all this, the proportion of liver cancer is increasing significantly and can reach epidemic levels soon. That is why it is important to be aware about the liver cancer. Similarly, pancreatic cancer is also on the rise. It is associated with obesity, but no other specific etiology is known. And the gallbladder cancer, which is strongly associated with gallstone disease and is quite common in the Indian population. Another similarity with these three disorders is that all of them need to be diagnosed very early to be treated and the patient getting cured. If it is not diagnosed early, then patients come to the doctors at a much later stage wherein cure is not possible. And that is why I will stress on the fact that the patients need to know few things about these cancers, and when they spot these things in themselves, they should reach the doctors early. So, which are these things? So, they are the symptoms. Symptoms like loss of appetite, symptoms like loss of weight, or symptoms like early jaundice, abdominal pain, any of these complaints, simple nausea, vomiting, discomfort in the abdomen, any of these can be manifestations of these three deadly cancers: liver, pancreas, and gallbladder. And when they spot such symptoms amongst them, they should immediately reach their local practitioners. And if the local practitioner suggests that there is any reason to do investigations, they should get the investigations done quickly. So, which are these investigations? These investigations are very simple. They can be few blood tests like liver function tests, or there are sometimes tests which are little more specific, and they include tumor markers. Tumor markers means the blood markers which can give evidence that a cancer is there in the body. So, doing these simple blood investigations, and if it is complemented with a sonography or ultrasonography of the abdomen, which is practically available at every nook and corner, not necessarily in the cities, but also at taluka levels, they are available. So, doing a quick ultrasonography may give some evidence or may pick up findings which are suggestive of a cancer, and one can pick them up early. If they are picked up early, then you can visit a specialist who is specializing in the liver, pancreas, and gallbladder disorders and do further investigations, which include investigations like a CT scan or an MRI scan, sometimes an endoscopy, sometimes a biopsy. And when these investigations confirm that any of these cancers are present, then one can plan the treatment early. If the cancer is operable, that is, one can do a surgery and remove the cancer, that is the best treatment for liver or gallbladder or pancreatic cancer, because these are the only, surgery is the only cure possible in these cancers. In liver cancer, sometimes yes, a liver transplantation is also an option, but also that is also a surgery. So I will say that surgery is the only curative or complete cure treatment for these cancers when possible. But when not possible, when the surgery is not possible, which can be because the cancer may be advanced, either it may be advanced locally, or that is, it may be spread locally, or it may have spread to some other organs in the body, or it may have spread somewhere in the abdomen, then these patients are not necessarily operable or a surgery is possible. Some of the lucky patients can undergo few cycles of chemotherapy or other certain treatment options, and then they can become ready for a surgery. And then surgeon like me can go ahead and again attempt a surgical cure on this patient. All this treatment is a little prolonged, a little expensive, and therefore, if the patient presents early, one can reduce the expense, one can achieve a cure without too much of expenditure. Can any of them be prevented? Only liver cancer is the one where liver and gallbladder cancer are the ones where one may consider prevention. Like in liver cancer, if it is viral hepatitis B, one can take vaccines and prevent viral hepatitis from occurring. Or if there is already detected viral hepatitis, like B or C, then patients can undergo regular treatment, which are simple tablets, and they can remain under surveillance using ultrasonography to pick up a cancer early. If it is fatty liver or obesity, they can attempt to reduce their weight, they can keep diabetes under control, they can avoid metabolic syndrome, and also remain under surveillance again to pick up a liver cancer early. Similarly, in gallbladder cancer, the gallbladder stones are significantly one of the reasons where the patients finally land up with gallbladder cancer. And therefore, all the patients with gallbladder stones in India, they should be advised an early gallbladder surgery, because in long term, they stand a risk of developing gallbladder cancer. In Western world, it is advocated that gallbladder stone surgery should be done only if patient is symptomatic. But this situation is not in India, because in India there is associated gallbladder cancer. So one should do a gallbladder stone surgery to prevent a gallbladder cancer in future. In pancreatic cancer, unfortunately, there is no prevention as such. So only early detection is what is there in our hands. So to summarize what I have said over last 10 minutes is that early diagnosis and early surgery is the best option as a treatment of these three cancers, and therefore patients should not neglect any symptom. Patients who have pre-existing liver diseases, they should remain strictly under observation and surveillance with their respective doctors to pick up the liver cancers early. Patients with gallbladder stone should undergo an early cholecystectomy to prevent a future gallbladder cancer. And patients with symptoms in any way suggestive of pancreatic cancer should come for surgery at the earliest. Thank you very much.